I'm Professor James Heaf. I'm a practicing clinical nephrologist. I've been working with peritoneal dialysis and home hemodialysis for the last 20 years at least. I work at the University of Copenhagen. I think the major advance the last 10 years has been the development of portable home hemodialysis. This has always been a major disadvantage for home hemodialysis compared to peritoneal dialysis. The peritoneal dialysis, you've been able to travel more or less throughout the world without any difficulty, whereas for home hemodialysis you had to have arranged guest dialysis if you want to travel abroad. Now it is possible to take your home hemodialysis machine with you to several places in Europe. An important part of home hemodialysis is that there's an awful lot more evidence accumulating of the beneficial effects of home hemodialysis on patient quality of life and survival. These evidence has previously been lacking simply because home hemodialysis is a relatively rare modality, but it's becoming increasingly common, particularly in Australia and New Zealand. Well, it's actually amazing. New Zealand and Australia have always been the world leaders in home hemodialysis, and they're way ahead of the rest of us. I'm really quite proud that in Denmark we have the highest prevalence of home hemodialysis in Europe, but Australia and New Zealand, they're way ahead of the pack. I don't know what the answer to this is. People usually say, well, it's because Australia is a big country and people live a long way from the city. It's not true. In fact, Australia is the most highly urbanized country in the world. I think 80% of the population live in cities. I think it's something to do with the culture. People like to look after themselves and not be dependent upon society. I think it's an excellent idea that the EuroPD has decided to have a session on home hemodialysis. You might think that it has nothing to do with the PD, but this is not true. I think the two modalities are actually very complementary to each other. They are both home-based therapies, and therefore they appeal to the kind of patient that want to be free from the hospital environment. And I think that when I talk to my patients, I say to them, well, if you want freedom from the hospital, you have a free choice, either home hemodialysis or peritoneal dialysis. Therefore, I think that all people who work with PD should know something about home hemodialysis so they can inform their patients in a qualified manner.